The views, comments, and opinions of the following program do not necessarily reflect those of Morris Media Studios, MorrisMediaLive.com, or its affiliates. Listener discretion is advised.
Blessed day, beloveds. Welcome to Faith Without Borders. I'm your host, Pastor Kelvin Sauls. It is indeed a joy for us to have you with us as we close out what we do every day as black folk, and that is celebrate who we are, even though February is that designated month to remember our heritage here in the United States. But it's also an opportunity for us to see how we can reset that heritage, because it's not just about reflecting on history, but it is about how do we, deal with what we are facing today and what is coming our way. So, in essence, it is about, how do we celebrate, the bold and broad shoulders that we stand on. And those who've paved the way for us. And so it is a joy for us to close out this month as part of our conversation around black health, or the health and the wellness, of black people. Here at Faith Without Borders, we seek to be a progressive and a prophetic platform that engages in thought-provoking and solutions-driven dialogue on critical issues that we face locally, here in Los Angeles, nationally in the United States, but also around the world. And today we're going to zoom in once again on COVID-19 with good news, alarming news, and of course, ongoing challenging news about how COVID-19 is affecting our lives. And so we have an awesome guest with us today, and looking forward to having him, be with us. This month, we of course pass the grim milestone of 500,000 plus souls that we've lost to COVID-19. Even though with any pandemic, you expect the loss of life, but certainly we all know that we didn't have to lose 500,000 sisters and brothers to this disease and to this pandemic. And so here we find ourselves, at this point where we are facing that. And so we are grateful for an administration that is about acknowledgement, that is about memory, because memory is a path to hope. And in that acknowledgement, we can then find enlightenment, which can then move us to a commitment to see, okay, what do we need to do different now as we move forward? And so we hope that you are part of the solution by practicing the 3 W's, and that is to wear your mask, to watch your distance, and to wash your hands. That is the best that we can do, complementing, what vaccines will do for us. Speaking of vaccines, as you know, the Johnson & Johnson vaccine has been approved, and I think it awaits final approval today or tomorrow, and then it gets shipped out and get into the arms, of people and all over the place. Speaking of getting it into the arms of people, we know that in so many ways there has been a disparity, not just in testing in black communities, but also in how the vaccine has been distributed, to black communities or in black communities. And so we are once again dealing with this whole challenge of disparity. And that's why, for today, our show is entitled From Availability to Accessibility, the disparity around COVID-19 testing and vaccination in the black community. We are aware of the disparity around how, COVID-19 has affected, black, indigenous, and people of color. And that certainly is an integral part of the history, of this country that we have to face. So disparity is real. Institutional racism is real. And it is not a broken record. But if it is not played, it will facilitate broken lives. And that's why it is so important to, on an ongoing basis, analyze how it looks like on an ongoing basis, look at it, see how we can understand it so that we can undermine it as we do that. So we're going to break all of this down and also share a very, very powerful toolkit, with you that was developed by our guest and the center that he is a part of. Speaking of our guests, it is a joy for me to welcome Dr. Greg A. Bolden. He is a nationally recognized consultant in men's health, community organizing, cancer, cardiology, and diabetes. He currently serves as the Community Initiatives Program Manager at the Center for Black Health and Equity. Very exciting to begin or continue our work, with this center. He has done extensive work, especially, in the area of the African American community and the health risk associated with tobacco, vaping, and its relationship to health concerns affecting African descendants. And that's an integral part of the work that we seek to do as we make sure that people understand this connection between respiratory health and COVID-19, around that. But also, he has 30 years of experience in public health and community medicine. He served as a co-principal investigator, researcher, and health educator for the American Cancer Society, advisor for the Congressional Black Caucus Health Brain Trust, and continues as a visiting scholar, at the Georgia Institute of Technology. I'm so glad that we have Dr. Bolden with us to share his thoughts and his expertise. And we invite you to join the conversation. There is an opportunity to ask questions. We ask that you go ahead and do that via Facebook, and we're going to do our best to work those in as he shares with us this morning. And so it is a joy for me to welcome to Faith Without Borders Dr. Greg A. Bolden. Dr. Bolden, it's good to have you. Good morning. Good morning. So glad you're able to join us.
Good morning. It's a pleasure to be here. Thank you so very much for inviting me.
Yes. I know you got 3 hours on us because you are you in North Carolina? Is that where you are?
No, I'm in Atlanta.
Oh, he's in the ATL. All right now.
Yes.
Atlanta. Georgia continues to be on our mind because of everything that's going on there, including whether we should have the NBA All-Star game coming through there. But that's another conversation for another time. Good to have you. Can you just share with us a little bit, Dr. Bolden, just the vision, the mission, the purpose, of the Center for Black Health and Equity?
Well, for the Center for Black Health and Equity, let me make it very simple for you. We facilitate activities and programs that address social and economic and racial disparities within the Black community. We are here specifically for the people of African descent,
Mm-hmm.
and we work diligently to address social, like I said, social needs, health disparities, all areas of the African American community.
Yes, and we're glad that we are partnering with you. As you know, I work with with Amplify here in California as we deal with respiratory health as well as how tobacco continues to affect the lives of Black people and the role that big tobacco play in disproportionately targeting Black communities around that. But we'll talk about that in a few minutes. We want to try and break some things down for folk. This the last couple of days, we've heard a lot about this whole piece around disparity. Certainly, we've experienced it, as it relates to testing. We are involved in testing here. We're facilitating testing for COVID-19, as well as vaccination. In just the fact that even though Black people are continue to disproportionately affected, by COVID-19. Yet, there's still, challenges with access, for testing and challenges with now, vaccination. In fact, what we are seeing, is that folk are coming, for us here from the west side, to the south side, or let me just make it plain, white folk, are coming into Black communities and taking the slots, around that. So we'll talk about that, in terms of how I can deal with that. But just explain to us when we use the term disparity,
Mhm.
what just break that down for us. Let's do a layman's a breakdown of this term disparity and how it relates to us as Black folk in the United States.
Mm. Well, when we talk about disparities, we are talking about a group of individuals, or it can be an institution where there are those who do not have the same access and availability that everyone else has. For us as African descendants, we have faced disparities through racial injustice. And when we talk about those types of things, we've found that there are those who have developed systems. They may not be individuals, it may be systems that are designed to disenfranchise us as a group of people. And it can be for anyone. We talk often about those who are African descendants, but the indigenous people of this
Mm-hmm.
nation
Mm-hmm.
have been disenfranchised, and they've also faced disparities. So when we're looking at disparities as a whole, we're looking at um, the inability to access the full and availability of any substance or any process.
Mm-hmm, mm-hmm. And that certainly plays out in so many different areas, in life, whether it's education,
Hmm.
whether in this case it's vaccination, around that. Can you maybe lift up for us just some of the drivers of disparity in general, but maybe in particularly, the drivers of disparity, as it relates to health?
Well, if I may, let me use COVID-19
Mm-hmm.
as a foundation for part of our discussion here. When we're looking at COVID-19 and the vaccine in and of itself, we find that for the disease itself, for the virus itself, we find that we have those who are in disparate populations that we need to address. We say that the African American community is disproportionately affected by
Mm-hmm.
the uh, COVID-19 virus. What we found is that the initial conversation was that African Americans are obese, they have higher rates of diabetes, cardiovascular disease, those comorbidities that are associated with the disease. But we failed to realize that in many of our communities have been redlined. We've been uh, forced into areas where We don't have the safest of communities. We don't have um, we don't have the supermarkets that are in majority communities, such as you out in California, you have Safeways. Here we have Kroger's. We have other supermarkets where we can actually get fresh fruits and vegetables. We are dependent on the convenience stores and the corner stores. In banking, we're a lot are dependent on check cashing places. So those are drivers that have been a part of the disparities associated with African American communities. Also, we've had jobs where we've been paid less or that we actually have to show up to.
Mm-hmm.
And we're actually living in homes many times where there's not one or two people in the home. There may be three, sometimes four generations in the home. And some people are actually living in 2 and 3 bedroom apartments where there may be 10 people living in it, which means that there's a sharing of droplets from individuals who may have had to go out to work at grocery stores, to work at convenience stores, to work in food packing plants that came home that may have affected that home with COVID-19. So we have to look at the full spectrum associated with the disparities when we talk about the African American community and other folks who have a low wealth communities.
Yeah, and these are all very interrelated,
Oh
in
yes.
terms of how it all just connects and cross over and intersects, and all of that, isn't it so?
Oh yeah, that is very much so, because when you think about it, oftentimes when in our community we don't have a primary care physician, and so there are many who are on medication who may or may not be able to afford their medication, so they're off their medication. There are just so many different factors that are associated with this. And so when we're talking about a pandemic, which we are right now with COVID-19, we have to take all of those things into consideration. And let me just say this, the only way that we're going to be able to overcome this is to take control for the most part for ourselves, which means that if a person has to go out to go to work and you're interacting with the public, and in some cases there are businesses who have no barriers whatsoever. So you're faced with facing the public on a daily basis, and you may be wearing a mask. I would suggest that you do wear a mask in those public settings, but then you have to come home, and then there may be another family member that had to go out to work who didn't wear a mask or who was um, working in an environment that actually put them at a higher risk. So that means that we have to start taking control within our own homes and educating ourselves. Now, let me just put this out there. You can't find everything on YouTube. You can't find everything on Facebook. I would suggest that you go to um, verified authorities for your information. And that is, and there's very simple. Wash your hands
Mm-hmm.
often. Wipe down those surfaces that a lot of people touch. We forget about the doorknobs that we touch all the time. Wear your mask, especially when you're out in public. And if anyone ever becomes infected with COVID-19 within the home, make sure you isolate them.
Mm-hmm.
Make a room for them so that even if you have a lot of people in the house, make a room for them so that you're minimizing the possibility of infecting others within the home.
Yeah, certainly. I mean, this is it's possible for us to really combat this. It's possible for us to
Hmm.
overcome, this challenge, given those three W's as I call them. But you and I know that we are also dealing with an epidemic before the pandemic, which
Hmm.
is institutional racism, and that just continues to be an ongoing fight, that we see, and not just that, but a huge backlash. As we make progress, there's always a backlash. Which I mean started, since after the Emancipation Proclamation. I mean there was an interruption, of that first a reconstruction period,
Hmm.
right, and that resulted, of course, in Jim Crow, and then the second time around was Brown versus Board of Education, and then there was a backlash, around, that in terms of the Reconstruction, that should have taken place, and then the civil rights. I mean, so every time we take several steps forward towards a more perfect union, there's just this backlash, against progress, backlash against, President Barack Obama. And now again, of course, what happened January the 6th was the surfacing of that backlash, even though we've seen that, really simmering underground, yet publicly and legislatively going on, in Congress under the leadership of, Mitch McConnell. Then, of course, he was joined by, Donald Trump, around that. So that it's just reality, around that. And I think, as we look at, all of this, it is so important that we just continue to, as you say, educate ourselves, to be proactive, to take initiative, to go the extra mile, while, at the same time understanding these are systems and schemes, that we are fighting, against. I know the center worked with the American Lung Association, to just create a toolkit, that is unapologetically, black, that really invites folk just to understand, COVID, because you're right, there are just so many myths and information and deceptive messages, on social media, and on the web, around that. And I really want to see if you can, share that with us. And so, as we queue that up, maybe you can, just share some introductory, thoughts about, that toolkit. And then I want to invite you to see if you can share that with us.
Okay, let me do this initially, because the toolkit is it was birthed at the Center for Black Health and Equity. The American Lung Association came and asked us if we would do a toolkit. It's an informational kit that we were utilizing for the Black community.
Right.
And we took liberties. We made it unapologetically Black. And we actually went in and told the story from our perspective. For example, did you know that the first vaccination that was developed out of a slave from sub-Saharan Africa? They named him Onesimus, and he was given to a Puritan clergyman. And when they had the smallpox outbreak, he actually told them of a system or a way of eliminating the possibility of one becoming infected to that minister. And that was by taking a part of the smallpox that one was infected with, and giving the healthy person a small dose of that smallpox, which actually their immune system was able to combat that. And that was the first ever time that in the Americas where the smallpox or a vaccine was actually introduced in the Americas. So it came out of Africa. And we will find that most of the things that we have in our medical profession actually came out of Africa. That is one example. Going forward to today, let me. I think it's important. Let me just share my screen that I have here.
Yeah.
Because I want people to see this person. Can you see her?
Yes.
Dr. Kizma Corbett. She actually has been working on this vaccine for more than 6 years, almost 7 years now. And the way that the vaccine was actually developed, and I hate the fact that they used the term warp speed. I have no idea where they came up with that name, but that's absolutely horrible name. But she has been working on this for at least almost 7 years, like I said. And even she said that we as Black folks, people of African descent, have earned the right to question that we've earned the right to ask questions that we have around these vaccines and the vaccine development process. Let me get that right. And we have to build trustworthiness. But she said herself, we're not going to be able to prove trustworthiness this instance quickly, and that's okay. Now, she's the one who helped develop this vaccine. She was uh, the architect behind this vaccine. It's a vaccine that was developed from the research that researchers have been doing on HIV. And because it's so effective, the reason why it's so effective is because it boosts our immune system. And our immune system is able to actually identify this virus now and to combat it. Now, it will not stop you from getting COVID-19, but what it does is it's designed to uh, help those to alleviate those severe symptoms that's associated with COVID-19, keep you out of the hospital, and keep you alive. So if you've noticed that since the introduction of the vaccine, the hospital rates have been going down, the severe symptoms associated with COVID-19 have been decreasing. Now, it's way too early to tell just how effective it is, but um, the initial view of this since it's been introduced has been very positive. And so it seems to be working. Now, what's our apprehensiveness? We all know about Tuskegee.
Mm-hmm.
That's one incident. It's horrible. It didn't end until I think 1972, and it started back in the 1930s. So it's almost 40 years of lying. And that system that we talked about earlier that was put in place to actually keep us and test on us. We know about Henrietta Lacks, who they harvested her cells, and now it's in every lab associated with cancer in the world, not just in the United States, everywhere in the world. So we know that there's a history associated with it, but people didn't know that the vaccines itself, the thought of the ideas around vaccines were actually started with us, with a slave from sub-Saharan Africa. We gave them the idea. They just took it and ran with it. We didn't know that there was an African-American sister who was in the forefront of developing this vaccine. And we stand with her. She's not going to develop something that's actually going to harm us.
Yeah.
Okay?
Yeah.
So we know about our history, but when we developed the toolkit in and of itself, we took what we do in our community. We know that we go to our pastors and our faith leaders to actually get information that we can share within our whole community. We know that we have conversations around the kitchen table. So we went and we addressed these issues, some of these issues, not all of them, that come up in the barbershops, in the beauty shops. When we talk about the kitchen table, that's what we're talking about. And also, as well as the kitchen table, but also in the parks and when we're having just gathering around. So when we talk about the kitchen table, these are conversations that come up everywhere. You said things like, I'm not going to be nobody's guinea pig. Well, the testing has been done, and I'll talk a little bit about that in just a moment, how it came to be, how it came to the FDA to be used as the emergency use authorization so quickly, and what happened and how it came to be. And that's also in our toolkit, the timeline. But we say, we're not going to be no guinea pig. You know about Tuskegee. Tuskegee will always come up, and it probably should. Being skeptical has kept us alive. So let me just say that we've been kept alive because we've been skeptical. And so that has helped us. In this case, being skeptical may do us more harm than good. But at the same time, we're not pushing folks to get the vaccine. We're trying to educate you so that you can make an informed decision yourself. And it is so important that you have a conversation with your healthcare provider because they know your records. They have your records. They know what you're allergic to. See, those are the types of things that we have to talk about. They know that what medications you're on, whether or not this vaccine will have an adverse effect on you because you're taking another medication. So you have to have a conversation with your healthcare provider.
Mm-hmm.
Um, we talked about people, you heard about folks say, man, if you take that, you're going to get a third eye. You're going to get a third arm. No, none of that has happened. I can guarantee you. And they said, well, we weren't a part of the testing. In the United States, people of African descent make up about 13% of the population. We know that when they did the testing for the clinical trials, there are about 10% African Americans that are in are part of the clinical trials, higher in some instances.
Mm-hmm.
So we've tested it. We know about the efficacy of it. It has been very effective. And within our toolkit, we actually provide quick responses, not only for you around the kitchen table, but for the pastors and the faith leaders. And it's just not churches, Christian churches. We,
Mm-hmm.
have Muslim community, the Benai community, all of the faith community, the Jewish, uh, all of the faith. It's appropriate. And we try to just put in the scientific facts that are
Mm-hmm.
associated with the toolkit itself.
Absolutely. Mm-hmm.
Um, we talk about, we have to have multi-generational uh, coalitions and people who are working in our elderly folks, elderly population are not used to computers. And so when they go online and try to make uh, get a appointment to get the vaccines, oftentimes what happens is others from other communities have gone in, and even if the vaccine is available in our community, they've gone in and they've stopped up the appointments because they're computer literate, and they can jump on those appointments quickly, and they have transportation. So they can get over to the community, get their shots, and get out. But what that does is that means that those who are living in the community don't have access to those vaccines, which is cause for another disparity. Um, so we've got to be multi-generational because we've got to work together to actually make sure we are able to get the vaccines, get the appointments, get to the places where the vaccines are being delivered, and we've had to work together. In this, I put multiple ideologies. You should have a conversation about the vaccine. I tell people all the time, you don't want to just put something in your body that's foreign to you that you know nothing about. You need to educate yourself on it, and you need to be able to have a conversation. Everybody's not going to take the vaccine. We understand that. But if you're not going to take the vaccine, and even if you do take the vaccine, it's very important to continue to wear your mask and to social distance and wash your hands and wash down surfaces that you touch often. But there are natural ways of building up your immune system. And one of those areas, and I'm going to touch on it right now, is
Mm-hmm.
smoking.
Mm-hmm.
Smoking weakens your immune system and makes you more susceptible to adverse effects associated with COVID 19. What am I saying? You're more likely to die if you get COVID 19 and you have severe symptoms than if you were not a smoker. And menthol is one of those things that are in our community that actually helps to absorb the nicotine and keep you addicted. And you inhale deeper into your lungs where you cannot, if you get lung cancer there, we're not able to operate on. And so one of those areas that we have to address is menthol use in the African American community because about 90% of African Americans who smoke menthol cigarettes. So I'm going to get off that soapbox, but I just wanted to put that out there for you and help you understand why we harp on that so much.
Yeah.
Uh, this is the front of the toolkit in and of itself. Yeah, we made it friendly, happy, and and we're talking about the immune system, the power of immunity. But we also gave you. Let me go to the next screen. This is a breakdown of the three types of vaccines that are being developed. The subunit from um, Johnson and Johnson was, like I said, was just approved yesterday, and within the toolkit itself, and we give you a breakdown of what the toolkit, what the vaccines do. One, we have the DNA, RNA, And that's kind of misleading. We know now because it's mRNA, this memory RNA. It does not, the vaccine that you take does not go into your DNA. It does not change anything within your DNA. All it does is it provides a subunit, like it says here, of the virus itself so that your body is able to recognize the, the virus and attack it. It attacks it before it spreads into your body, which actually enables your body to reduce the possibility of you having severe symptoms. The viral vector is one that has not been approved yet. I think that's out of University of Oxford and AstraZeneca. And some of those have been approved outside of the United States, but they have not been approved in the United States to be
Mm-hmm.
used. So
Mm-hmm.
right now we have the Moderna and we have the Pfizer, which was approved and is being shipped out now. It's being used now. And yesterday we had the Johnson and Johnson, which is one shot, uh, which was approved, like I said, just yesterday
Right. Mm-hmm.
by the FDA advisory committee.
Yeah.
And again, if you want the toolkit, you can just go here, right here at the toolkit, and download the toolkit uh, for use.
Absolutely.
Within the toolkit, we also give you some examples of social media and how you can actually have conversations within your community around the vaccine itself. And we would encourage, I strongly say that, encourage that you have vigorous conversations about the vaccines, but actually get the information that is available, that's reputable.
Mm-hmm.
And we also, within the toolkit, once you download it, you'll actually, we give you resources. So on the Moderna and the Pfizer, and we'll update this for the Johnson and Johnson vaccine as well. But
Mm-hmm.
these are all available. And we have within the toolkit itself, we actually put in uh, webinars that
Mm-hmm.
we did around the vaccine so you can get a better understanding of it.
Yeah. Wow.
So
That's
that's our contact information. Let me stop sharing here so that we can continue our conversation.
Yeah, I mean that toolkit is just so powerful. Oh my gosh. And it's electronic. That means that the center will be able to update it on an ongoing basis. Is that my understanding?
Right. As
Yes.
the new information comes available, we'll be able to update the information that we have on there. For example, Johnson and Johnson was just, like I said, was just authorized yesterday, and so what we'll do is we'll go back in and
Mm-hmm.
we'll update and we'll put a link to Johnson and Johnson and
Mm-hmm.
their information that they have on there.
Yeah.
Oh, I promised that I was going to talk about this horrible thing that they call warp speed.
Okay.
the when developing any vaccine, and I've been involved with this for years, and
Uh-huh.
let me just tell you, when I heard the words warp speed, my initial reaction was, no way.
Yeah.
There's no way I'm going to go. No, you're kind of going to develop something in 8 months. When I know that in many cases, in developing a vaccine, it could take 5 to 10 years.
Yeah.
It could take a year just to get funding. But I had to dig deep, I mean, really deep, to find out what was the difference. Let me give you an example. So first, phase one is that what you do is you've actually developed a vaccine
Mm-hmm.
and you do it in-house. You do testing in-house. Phase two, you do a small group of individuals that you can test on. Well, you do animal testing and you do a small group of individuals that you can test it on.
Mm-hmm.
Phase three is when you go to do a testing in a larger setting, in an academic setting or somewhere like that. Now, let me give you the numbers. Normally in phase one, you don't have any people involved. Phase two, you may test it on maybe 100 people or so, and that's over a period of years, maybe over 2 or 3 years. Phase three is normally over 2 or 3 years, and you normally have up to 3,000 people on there. What they did in this case was in phase three, they tested it on 30 to 60,000 individuals,
Mm-hmm.
so that we could make sure that it was it would work on those individuals and they would not have adverse effects.
Mm-hmm.
when we talk about adverse effects, hospitalizations, were there any deaths associated with it? Were there, did people have an adverse effect to the vaccine where it would cause re- irreparable harm to them or cause harm within their system based on the other comorbidities that they may have?
Mm-hmm.
We didn't find that. We found a very few that were that had adverse effects.
Mm-hmm.
That's why they came out with I think Pfizer had about a 95% efficacy rate,
Yeah.
and I think it was Moderna had about the same level.
Yeah.
Now for Johnson and Johnson, this one shot, there's an efficacy rate of um, about 70, 74, 76%. Now, that's still comparable. That is still effective.
Yeah.
But out of all of these, there were no hospitalizations and there were no deaths.
Yeah.
So those were the things, it was very effective against what they call the variants now.
Yeah. Mm-hmm.
So all of these vaccines have been proven to be extremely safe
Mm-hmm.
and and effective.
Yeah.
So right now, and like I said, they've been working on this for Dr. Corbett has been working on it for 7 years. She's the lead, and what they did was they actually took the research and the work that they had been doing around HIV because it actually affected the immune system
Mm-hmm.
and the respiratory system. And what they did was they repackaged it,
Mm-hmm.
and so they identified what um, they identified what would be the effective measure of developing this vaccine, and they produced that.
Mm-hmm.
So the vaccine has been proven to be very effective in all instances.
Yeah. I want to quickly get to, because I know you have to go, but this whole, I'm getting a lot of questions around efficacy,
Mm-hmm.
between the three vaccines now. And, should I take one, as opposed to the other around it? Can you maybe just say a little bit about, how do these three, compare and
Mm-hmm.
its effectiveness and impact that it can have?
Let me just say this: all three have been proven to be very effective.
Okay.
But let me caution you: you should have a conversation with your healthcare provider.
Okay.
I know for a fact that Pfizer was not part of the warp speed, the government uh,
Mm-hmm.
programs. Moderna was, and that's one of the ways that they got around some of that timeline, was they actually put up money uh, to develop this. But as far as being effective, all three are very effective. Now, here's one caveat: you should not um, mix the vaccines. So if you get the Pfizer vaccine, excuse me, your second shot has to be the Pfizer vaccines.
Mm-hmm.
Here's how they work. What it does is the first vaccine actually helps to boost your immune system, and then you have to wait about 3 weeks up to 28 days. Well,
Mm-hmm.
actually, you can wait more weeks than that. That's what they recommend, 28 days to go get your second vaccine. Now, what the second vaccine does, it actually kicks your immune system into overdrive. That's where we've seen um, some of the don't want to call them adverse effects, but some of the reactions that people may have to the vaccine, because then they said they have headaches. There's
Mm-hmm.
headaches. There's
Mm-hmm.
soreness at the site of the puncture. There are uh, people feel a little bit nauseated, because that's when your immune system is going into overdrive. So it's looking and it's reproducing and it's making sure that it's set up so that if you become infected with the COVID-19, well, actually with the SARS COVID-2,
Mm-hmm.
this is actually the seventh iteration of this of this virus.
Yeah.
You know, so uh, so your system goes into overdrive to actually protect you from that virus.
Yeah.
Um, One of the good things is it may protect you from other ones,
Right.
virus in these same families.
Yeah.
So, so being effective, it's a very, very, very effective. but stick with the same vaccine that you get. Johnson and Johnson is only one vaccine, one shot, so you don't have to worry about that. But for the Moderna and the AstraZeneca, we recommend that you stay with the one vaccine.
Yeah, absolutely. I really, I mean, that toolkit is so powerful. I really appreciate the multi aspects of it, around multi generational, multi socioeconomic, status, as well as multi, ideologies. I mean, it just really creates an awesome platform, that invites, conversation, reflection, and so that people don't feel like they're being, beat over the head, but really, what I've discovered is just having conversations with people. I mean, Scripture tells us, people perish for the lack of knowledge,
Hmm.
and we know that the more we know, the more we can make the necessary adjustments that we need to make as we face this, a pandemic, around that. Now, Dr. Bolden, I know we're going to have many more conversations, but before you go, I cannot let you go without you telling us, about the conference that's kicking off on March the 2nd. And I think we have a flyer we'll just post about it. But tell us about the State of Black Health Conference that's going to take place this week. March the 2nd, through the 3rd. You guys are going to have so many exciting speakers, and there's one of them. And but tell us a little bit about this conference, and just its vision, its mission, and what to expect at it.
Oh, well, thank you so very much. Thank you for reminding me. The State of Black Health is our premier conference that we do every year. This is our first year doing it virtually.
Mm-hmm.
And we get together, and we are Black folks that we have to understand. Oftentimes, there are many people of African descent who are working in environments where they're the only ones there, and they want to actually folks that they're working with want to try to reach out to the Black community, and they'll give them directions on how they need to go out and reach the Black community, and they'll say, "Oh, okay, all right. Well, this is an opportunity for us to come together and say what we want to say, and actually design and address the issues that are pertinent in our communities." And what the State of Black Health takes place on, like I said, March the 2nd and 3rd, and I believe this registration is still open today.
Mm-hmm.
And for those who, if you'd like to join us, we go to www.stateofblackhealth.com, and you can register there. Um,
Yes,
so,
yes.
and
Well, I've
it's
registered, and I'm looking forward to participating. And I know several of our other faith leaders as part of our transnational faith leaders cohort, dealing with respiratory health, and how tobacco affects, our health. I know some of them will be registering, so we'll have some folk joining, not just from right here in California, of course, but both from South Africa and Namibia, just to let you know that. So they're excited about the opportunity, and they're going to catch as much as they can given the time difference.
right,
but
right.
I was glad to give them, some, recommendations as to what to make sure that they catch. But I'm very excited about just being part of this conversation as we bring together faith and
Hmm.
health, science and
All right.
medicine, to facilitate abundant life,
Hmm.
around that. Now we are gonna bring you back when we talk about mental health Sunday and all of those pieces,
Hmm.
because I know you have to run to
Well, no,
a
let
next
me just,
meeting. Hmm.
can I just say a little bit about that?
Yes, go ahead.
All right,
Hmm.
I'll take a bit. They'll wait. We do an event every year. It's called No Menthol Sunday.
Hmm.
Now, the reason why we're doing this is like I mentioned earlier, about 90% of people of African descent who smoke menthol cigarettes. Menthol cigarettes, like Newport, has the number two market share of all cigarettes in the I know in the United States. Let me put it like that. It may be in the world, but in the United States, they have the number two market share. Uh, we found that menthol wasn't introduced until 1932, and in 1950s, only about 5% of African Americans who smoke menthol cigarettes. Now it's almost up to 90% of African Americans who smoke menthol cigarettes. They have been targeted by our community. Our community has been targeted by the tobacco industry, and the reason being is the tobacco industry makes about $200 billion a year. And each year, just from menthol cigarettes, they make up about a third of that. So of that overall base. So if you're looking at $200 billion per year, we're talking about 30-40 billion dollars and they don't want to give that up. So they make up lies about what will happen if they get rid of menthol. So we're working to get rid of menthol commercially. They want to take it and make their own. That's on them. But it's actually working to get that off the streets. We are not targeting the users of persons to continue to smoke menthol cigarettes. That's on them. We're not making this a law enforcement activity. Matter of fact, we are discouraging law enforcement to even be involved in this. This is the changing of our community norms. We're going to take back our community. We are no longer going to be the piggy bank for the tobacco industry, and we're going to save our people. We're going to extend the lives of those who are currently smoking. We're going to create smoking cessation programs so that people who want to quit can quit, and then we're not going to beat up on the other folks who continue to smoke. But No Menthol Sunday is designed to be, which will take place May 16th, is designed to be an educational eye opener for our community so that we can educate them around menthol and how the tobacco industry has targeted us. And we're asking faith communities to encourage their congregations to give up their menthol cigarettes for a day. Hopefully it will work and they'll continue beyond that day. And matter of fact, last year we even had some retailers who joined us who refused to sell menthol products on that day. So it's a wonderful opportunity, and we look for folks who want to work with us and help develop and get the word out. So
yes, we're looking forward to that. And as you mentioned, it is not about the condemnation of smokers. It is about compassion towards them and collaboration with them to see how we can invite them, into healthier lifestyles. Because in the end, it is about how we're inviting people into living, healthy lives and pursue wellness. And that smoking has, since our ancestors arrived here, they've been, in those tobacco plantations, and now, it's all been turned around. And it's being, we are now we were the producers, now we are the users. And guess who's still in charge of all of this stuff, you see, around targeting us and trying to take us out. So for us in the faith community, it is about the health and the safety of our community, and to really speak truth to power about the intended consequences, of smoking, and how to play an intervention role by way of cessation as to how we can turn this around. So I'm proud and glad to be a part of that movement, and we're looking forward to as we make our way towards May to talk more and more about that, to try and see how we can share in that opportunity. Dr. Greg A. Bolden, thank you so much for joining us. I know this is going to be the first of many that we are going to have. I know you all are getting ready to manage this conference, and I'll be somewhere there in the virtual world with you, getting enlightened and educated as we continue to facilitate health and wellness for Black people and in our Black communities. You have any final thoughts, and then we'll release you.
What I was going to do is I'm going to put the link for the toolkit in the chat.
Okay.
Great. And hopefully folks
can pick it up. Yes. Yeah.
And I'm trying to manage two screens at the same time.
Okay. Great. So thanks. While you do that, thank you so much. There it is. www.lung.org/vaccine-toolkit. So please check it out, and we'll also pick that up, and we'll get it out, to our faith leaders, especially this week, because here in Los Angeles, we are right now working on mobilizing and organizing, our faith communities to continue to increase, in becoming testing sites as well as vaccination sites, as we tap into that very, very, powerful resource that we have in the community, which is the faith community in general, but in particularly Black churches, and so that's on the way, and to try and see how we can facilitate accessibility, to both testing and vaccination. Dr. Bolden, thanks so much. Godspeed to you, and looking forward to our ongoing collaboration.
Thank you so very much. I appreciate you inviting me today. And I also put our center's website in there so that people can actually reach out to the center. And let's not forget the African American Tobacco Control Leadership Council, which is located there in California.
That's right.
Who are actually working diligently toward this same in the same effort in this community.
And we're glad to be in partnership with them. In fact, I was hanging out with Carol yesterday. And so that was a good. She, Yolanda, and the entire team, and Nesta, they're just doing an awesome job, and I'm just so privileged to work with them, on all of these matters. So thanks so much.
Thank you.
All right,
take care. Thank you so very much. Let's work together, Black folks.
Yes, sir. Yeah, we can do it. We can do it.
Yeah.
All right.
No, I'd like to change that. Let's work together, descendants of Africa.
As a Black immigrant, I appreciate and celebrate that. Yes, sir.
Yes. Thank you so very much. I appreciate it so very much.
Take care.
I appreciate you.
Great. Yes, that was just awesome. And again, we always want to figure out ways to educate folk and get information out to you so that you can have this. And really grateful to, Dr. Bolden for that. We want to just lift up some additional events that you want to be aware of that's going to be taking place today so that you can check it out. There you have it this afternoon. Sanctuary of Hope, one of our partners here in Los Angeles, is having part 2 of their, Black Narrative series entitled Elevating Black Civic Engagement. There you have it. It's going to be moderated by Dr. Anthony Samad, from Cal State University, California State University at Dominguez Hills. He heads up the Damali Institute there. And you saw all of our guests there. Can you put that flyer up again? These are all folk on the front lines that I have the privilege of working with. Our assembly, woman there, Sydney Kamlaga Dove, who I'll say something about in a minute because of what's happening on Tuesday. There he is, Dr. D'Artagnan Scorja, doing excellent work right now with the county, and he actually was with me and some young people going to South Africa. And then Pastor Juju, Najuma Smith-Pollard, there she is from the Cecil Murray Center for Civic Engagement. My brother Bernard Dory, who is a political strategist, and the person that's pulling them all together is my sister Jenna D. Kelly, who's the executive director of Sanctuary of Hope. Check it out, and you can check out also that website, for that exciting opportunity coming up this afternoon. We want to remind you, Tuesday is voting day, believe it or not, March the 2nd. It's a special election for us here. As you know, Supervisor Holly Mitchell was State Senator Holly Mitchell until we elected her and invited her and her gifts, her passion and vision to join now an all-women Board of Supervisors here in the county of Los Angeles. We're very excited about that. And so that means that her seat as that senatorial seat at the state level is open. So there is a special election for that, on Tuesday. Voting centers has been opened. Make sure you get there, cast your vote. I'm looking forward to rolling through there on Tuesday to make sure that my vote, is counted. I mentioned Assemblymember Sydney Kamalaga Dove. She is running for that seat, a mentee of Harley Mitchell. But not just that, but she is, a warrior for us, at the state level, just facilitating very, very strategic resources for our communities here in this district. I am in her district, and so I've worked with, in fact, one of the first meetings when I got to Homer United Methodist Church that I had with, and the staff of an elected official was Sydney Kamalaga Dove. She then was the district director for then Assemblywoman Harley Mitchell. And so, and we talked about, again, another health challenge in our community, which is neighborhood oil drilling, that's taking place still in our communities, disproportionately communities of color are these frontline communities. I will never forget our first meeting together, and then that then connecting us, connecting me with Harley Mitchell, and the rest is history in terms of the work that we've been able to do here. And so please check up all the candidates. You should have figured out by now who I'm voting for. And that is, because of her ability, her vision, as well as her way to collaborate, with others to get the work done at the state level, for our communities. Thanks so much for joining us. This has been Faith Without Borders. I'm your host, Pastor Kelvin Sauls. We closed out Black History Month, getting ready for Women's History Month. And so we'll be back in 2 weeks, emphasizing, looking at, the strategic and powerful role of women, and what they've been able to facilitate. You saw today, with Dr. Bolden, there was a Black woman, that's been working on, vaccinations for a very long time. So we're going to lift up, just the power and the leadership, of our Black women. I call them the bridge that they provide is through their backs that we so appreciate and celebrate. And so we'll look into that, within 2 weeks. Thanks so much. Be well, stay safe, and remember that beloved community is possible.